Good morning and welcome to COVID-19 update on Silverbird Television. I am Georgina Ndukwezanka. Now, this program is brought to you by Widows and Orphans Empowerment Organization with the support of USAID Effective Water Sanitation and Hygiene Services e-wash program. Let's take a brief look at the background to this topic. Now, we all knew when the spread of the novel coronavirus disease came into Nigeria, and we have continued to record an increase in cases as the latest statistics provided by the Nigeria Center for Disease Control reveal that as at 16th of December 2020, Nigeria has recorded 930 new confirmed cases. Till date, we have 75,062 cases confirmed. 66,775 cases have been discharged, while sadly, 1,200 deaths have been recorded in the 36 states and the Federal Capital Territory. Now, since the outbreak of COVID-19 in Nigeria, the federal government has been doing so many things, implementing several measures to stem the spread of the coronavirus. This program is aimed at preventing further spread of the disease by creating awareness on the importance of observing hygiene and maintaining good hygiene practices and following, of course, the laid down COVID-19 guidelines to prevent further spread of the disease. Second wave of COVID-19 is upon us, and the rise in the curve has necessitated the need for more awareness to be created, even as we enter the festive season. That is why the focus of the program today is adhering to hygiene and sanitation guidelines during the festive celebrations. We are going to be traveling soon. You have to be careful. You can be a part of the conversation by calling in the studio line 081 058 30411 081 058 30411. And we have our guest already seated in the studio, very brightly dressed. She is an assistant director, Federal Ministry of Water Resources. She's, of course, also the acting coordinator, Clean Nigeria, Clean Nigeria Campaign Secretariat, Mrs. Chizoma Opara. Thank you so much for coming on the program.
Thank you very much.
Really glad to have you.
Thank you.
Awesome. Okay, so we'll start first of all with your thoughts on what can be done to stem community spread of COVID-19. We are seeing the rise in cases. We had thought we were already tackling, the cases that we're having at some point, and then we are beginning to see more and more people present with symptoms. What can be done to stem this tide?
Thank you very much. I think I would say that we actually, the rate at which we started in terms of engagements and massive awareness creation and all that, I think it's actually reduced, because I remember just with the lockdown and immediately that was lifted, we noticed that all the supermarkets complied, most of our public places all complied, and we also saw these facilities present in every premise, like the ministries, offices, and there was strict compliance, because people were made to actually ensure that they wash their hands or use the sanitizers before they enter these offices. But that actually reduced, because if you go to most of our supermarkets, as if it's history, and that's exactly what happened, during the this pandemic that also, ravaged the country sometime, and then we noticed that that actually also immediately after that, everybody goes down and continue the normal business, because the issues around hand washing, with the continuous promotion of hand washing, particularly the Global Hand Washing Day commemoration, which comes every 15th of October. And this year, particularly, the message was hand hygiene for all. It's still a whole lot of focus around washing our hands, using the sanitizers and all that. But we noticed that a lot of that has actually reduced, and that is why today you see that it seems to be rising because we are now kind of waving it off, with a side of the hand. It's okay, and living our normal lives as if it does not exist.
Mm. And that's a very dangerous trend because it's going to become um, very, very difficult to control if people relax.
Yes, because with the Ebola, it was different because it actually was completely eradicated. But we see this as something that's new, and the only way we can actually combat the spread is to ensure compliance, and the compliance level must actually step up, and we need to see more of media buzz, a whole lot of action activities around stopping the spread. Now, you also notice that most of our schools, again, you see notice more compliance within the school system because the teachers are there to say stop. Ensure that you wash your hands. You before you're feeding, you have to wash your hands. You use the toilet, you have to wash your hands. But if that has to come back in most of these places, then I think we really have to do that because we must ensure that people actually before you enter premises and all that. So let us bring back our memories to all that so that everybody understands that if and the second lockdown would not be very good for the country.
Mm. Now, what are the roles hygiene play in preventing transmission? Like you mentioned, regular washing of hands. Some people, as soon as they get home, they go straight to the bathroom, remove their clothing, and have their
Exactly.
bath. But some people may not even think it's necessary. Tell me more about that.
Now, it's all about the virus. Now, you once you have had contact outside, you don't know where. You would also believe that at least maybe in the course of my daily activity, I would have had contact with maybe someone who actually has the virus and all that. So the best thing that you have to do once you get home, you remove your clothing, you take a wash, and then once you are able to do that, you are sure that at least you are safe. And because we actually know that hand washing is quite key and it cuts that drastically down. And we actually need to see that we do that to ensure that we actually stay safe and to also comply to all other everything that we need to adhere to the safe distancing. And then if you also notice that many people have gone back to shaking hands and all those
Exactly,
things are coming back.
exactly.
So we need messages, we need more of the talk around that so that we also know that it is not yet over until it is
Until
over.
it's over.
Yeah.
Wow. Poor adherence to COVID-19 prevention guidelines, like you mentioned now, the shaking of hands has remained a concern, especially where people work in very tight spaces. Most of the companies have resumed full, operations, and you get to see 5, 10 people lumped up in a small space. How does this concern you as it relates to hygiene and sanitation? People in such company or organization that would have to work like that, they have no choice. They have to work because they have to earn a living. What do they do?
you know, the adherence, plans that we have from the onset is you don't touch your face, you don't touch your mouth, face, eyes, and all that. And then where you are constrained with space, because I also know that there was most companies didn't just open, and then places, most ministries actually, restricted, coming to the office with just a few people, and then some others were actually working from home. But now with now that so many, of course, everybody has actually resumed back to duties. I think the best thing that we have to do is to ensure. I still believe that we ensure strict compliance to all this. Now the hand washing facilities are there. How many of them do we use? Because I know that if we use these facilities as often as possible. Now also when they relaxed the lockdown, you notice that everybody had sanitizers in their pockets. Look around you. How many people now have these sanitizers around them? So these also have to be provided within workplaces to ensure that all the time you have them. If you must have, gatherings, you must maintain, the social distancing, and then also make sure that these materials are available, the hand washing facilities, the sanitizers, and of course the face masks, and ensure that there is strict compliance to this. And if most organizations actually work on that, I think would go a long way. Now, I also look at the fact that, like, most of these, security agents, the people, maybe your securities at offices and all that, how many of them actually understand what we're doing? I think it's also like, because where they understand, you notice that even as you enter the office, someone is actually directing you, please wash your hands. So I think we actually also need to take that to the next level to see that most of the people within these premises actually are compliant to what we are talking about, the messages and the compliance level of the COVID-19, so that once they are able to ensure that people coming in into premises actually comply, you see that it will go a long way to actually bring this down.
Wow. Now, you've actually touched on my next question, which is your assessment of public adherence to prevention of guidelines, the prevention guidelines as laid down by the NCDC, talking about ensuring people wear their face masks, provision of hand washing facilities in public places, and all that. For the government, making provision of this for people who cannot afford the hand washing facilities. What do you think the government can do? It's, the Ministry of Water Resources, has one link or the other to ensuring water is provided for, communities or, public places. How is the government doing this? What's the process?
Okay, while during the lockdown, we also had the Honorable Minister of Water Resources, Engineer Suleiman Adamu, actually championed the COVID-19 WASH emergency response, and with that on board, and with the honorable commissioners of water across the 36 states and FCT as members of that, they were able to, develop a kind of a support to states. And with that, we had water, being provided to states, and also toilets, because we also know that apart from the hand washing, which is hygiene related, we're also talking a whole lot around sanitation and making sure that people build and use toilets. And then, of course, hand washing of facilities. And a whole lot of, like most of the private organizations have also, provided some kind of support or the other. Now, let me just take us back to the 15th of October, which when the Global Hand Washing Day for 2020 was commemorated. And here in Abuja, the honorable minister and the fellow ministers actually visited the prisons and took that message down to the prisons, because we're also saying leave no one behind, to make sure that everyone is part of it. And across states, they also celebrated, they commemorated the Global Hand Washing Day, and they also try to reach out to as many as possible. But the problem, like I keep saying, that as soon as the celebration is over, everyone goes back to sleep. It shouldn't be so. That is when, the I should say, would I say, ovation is loudest. We would now have to beat the drums in terms of sounding, these messages as loud as we can. Dramas, in the air, and a whole lot of songs. Not they should pass without hearing a whole lot of messages around ending reducing the spread of this virus, and then talking about the whole lot of the adherence, compliance, and all that, just to make sure that because if there is one thing that is very, very difficult to change, is behavior. So it's something that you have to continue. It's a continuous thing until we get used to it. Because I also remember there was a time, we had a theme for hand washing, which we talked about making hand washing a habit. If maybe from that year we actually, were able to get to the level of it has become a habit, this wouldn't have been a problem. But we see it as a problem because as soon as, whatever commemoration is over, we all go back to sleep. So I think it's something that we have to take as part of us. It has to, because we have to learn to live with it. And learning to live with it means we have to, maintain all the measures, compliance, and all that, just to make sure that we're all safe and our loved ones also are safe.
Okay, in passing, you talked about potential second lockdown might not be beneficial to the economy, but don't you think it's something that the government should look towards doing to ensure they stem the tide of community-based transmission?
Now, just like I said, there was a time, Ebola was ravaging and everybody was on his feet and everybody was like, yes, we have to do this, we have to do that, and everybody complied. But shortly after that, everyone went to sleep. Now we had a first lockdown, and that lockdown, everybody knew that we needed to comply. But why has it suddenly gone low? So something is wrong somewhere, meaning that even if we have a second lockdown and then you now open up again, we are bound to have, unless we address some of those issues. And those issues are constant reminders, awareness creation. Let us continue to use. Now we're talking about our community leaders, our religious leaders, traditional leaders. Now, maybe I'm going to be taking your next question. I don't know, because this is festive period and everybody is going home. Naturally, you also see that a whole lot of communities will be holding their, end of year meetings,
Festivities on the
festivities, and
year.
all that.
Yeah.
Weddings are happening. What is the level of compliance in all this? So if we can take all these, can factor all these into whatever we are doing, I think we'll go a long way, because these our leaders are key. And because we know that when they talk, our people listen to them. So we need to push to ensure that most of our community leaders, our traditional leaders, our religious leaders get these messages and then they push it down to the people. And that is the only way we can actually avert the second lockdown.
You are watching COVID-19 update on Silverbird Television with our guest, the Assistant Director, Federal Ministry of Water Resources, also Acting Coordinator, Clean Nigeria Campaign Secretariat, Mrs. Chizoma Opara. And this program, of course, is brought to you by the Widows and Orphans Empowerment Organization with the support of USAID Effective Water Sanitation and Hygiene Services Program, EWASH. You can call in the program and make contribution. You can also ask questions. My guest is here to respond to you. 081058030411. It's actually on the screen. So please, the number is on the screen. You can call in and let's get to hear from you what your thoughts are. Will you be traveling? What measures are you putting in place to ensure that your family is safe? Okay, so there's a time for you to call in. I'm sure my producers will be able to link you up to this live studio for that. Let's now talk about the issue, the festive period. You've touched a little bit on that. I just want to find out from you what your candid advice is to everyone on preventing the spread of coronavirus this holiday season.
This is to ensure that we maintain this safe, social distancing, and gatherings. If you must, then you must ensure that you put on your face masks and then, of course, the sanitizer and all that. And for the organizers of these programs to also ensure that these are strategically located within the venues of these gatherings. As much as possible in our homes, we should also have these readily available in our homes. And take, for example, if I lead by example, and you also lead by example by way, because you understand, the importance of all that. Every other person will, follow suit. Take, for example, many people will be traveling within this period, and right in front of your house there is a hand washing stand, and you are ensuring somebody is, and please wash your hands. And the person will, like, what is going on if the person has not been doing that? And I think they will pick that up to say, okay, they are doing it, so we have to join them. Or maybe you have the hand sanitizers readily available. Please sanitize your hands before you come in. So as much as possible, let us try to ensure that these are readily available. And when we have opportunity to talk to people, let us not hesitate, because you may be saving a life.
Now, I'll still come back to the role of the federal government now in providing basic sanitation facilities, basic hand washing facilities, water, portable water. In the rural areas, we do not have, most rural areas do not have pipe-on water, and that's the truth. So how can we ensure that this category of Nigerians are safe this period?
Okay, I just like I said earlier, we under the COVID-19 wash emergency response, that is also already happening, where we have over 1,005, more than 1,500 or thereabouts facilities that have been constructed across the country, and then including sanitation facilities, and also the hand washing facilities are also being. But I know that that is not enough. We also are expecting that the states should also comply. States should also make provision for some of these, and then we're also calling on our private sectors, the various, because as of today, we have an organized private sector in the water sanitation and hygiene. So we're looking up to everybody. All of us are in this together, and together we'll come out of it if we work together towards a positive, end of all this. So all of us must make an effort in our own little way. And from the government side, I would say that efforts are already being put in place, and the state governments and the local governments will also expect that they should actually comply. Because I also remember, well, under lockdown, a whole lot of the local governments carried a whole lot of campaign. We saw what was happening. They went into the markets. This is also a time not to stop all that, to make sure that they actually go into the where we have these opportunities, go into the markets, and also continue to push this campaign as far as that can go.
Now, for alternative um, things to do where water is already available. There's something I read about hydrogen peroxide, that's use of spirit in place of a hand sanitizer, or ash. Using of ash to wash the hands. Someone on the show actually mentioned that where water is not readily available. Do you think it's safe? Because not everybody can afford to get have a hand sanitizer.
Not everybody, so everybody can at least to an extent afford just a little water.
Mm.
You make use of water and soap, to wash your hands. Yes,
Okay.
that has been provided, some promotion has actually happened around the use of ash when you use the toilet, and then you use the ash to wash your hands and to clean your hands and all that. But I think it's best that we use the water and then we use the soap.
Mm.
So as much as possible, if we can use that, I think it will go a long way to help to cut that spread.
Okay, so for parents now, I don't know if you you would have one or two things to talk to parents about, the children this holiday season, how to guide them, what to tell them regarding preventing the spread.
Incidentally, a lot has happened within our school, environment, and you'd actually be shocked that the children will actually be making a whole lot of contribution positively within homes, because a child, all through school, wash your hands, wash your hands. By the time that child is coming back, that child is already teaching every other person, because in the course of our, campaign to end open defecation, where we ensure that we are saying that people should build toilets, use toilets, wash your hands. You see that in that kind of situation, most of these children, once they teach them, they don't forget. And you see the children coming back, Daddy, you came out of the toilet, you didn't wash your hands. A whole lot of them are saying it, and many are giving testimonies. I saw a situation where someone was actually giving that kind of testimony. In fact, it's my granddaughter that would come and say, Mommy, this is the way to wash your hands. 20 minutes, you are washing your hands, and again, in most of the communities, I remember some testimonies too, where most parents would say, Madam, the problem we are having now is that now children are wasting soap. So it's to tell you that
is a good problem.
It's a good problem.
It's a good problem.
Exactly. So you see now that the children have imbibed it, and that is why teach the child, and the child doesn't forget. And you see the child actually, and that's why we say the children are great agents of change. And with the children, continuous teaching, continuous mentoring to the children, you are very, very sure that the next generation will actually pick this up. So you'll be surprised what will be happening within this period that the children are coming home. They'll now be the ones that will take it up, and they are the ambassadors in most of their homes.
It is good. Please allow them waste the soap. If your child comes home and washes his or her hands 10 times, please allow it, because it's a good one. It's a good one. Okay, so we would be getting your last words at this point regarding people that are going to the east. My fellow Igbo brothers and sisters will soon be, the town will soon be empty.
Yes.
They'll all go home. And like you mentioned earlier, lots of festivities, burials, weddings, and all that. Tell us step by step what you think they should do, especially people in the East that do not believe that they have COVID-19 in those states. Because I've heard several people say, don't wear your face mask here. There is no COVID-19 here. And then you don't know that you are actually getting infected and you're actually spreading this virus.
It's really a very big problem. But the best way to go about it is we must have our champions. And where do we find these champions? Like most of our rural and the most of our and the NCDC within the states, the rural water supply, looking up to them to actually continue this and not stop. So wherever we find ourselves, for those who will be traveling, please, it's really that you comply to the
Later.
standard. Make sure that the face masks for those who also will be planning gatherings, make these available even to the public.
True.
And then for the hand sanitizers and for the hand washing stands, once we have as many as possible around such premises, ensure that they are also used. So I think that's the message I have for all of us. Let us all stay safe, wash your hands, and stay healthy.
Thank you so much. Remember, you have to wash your hands with soap 20 minutes. Avoid touching your nose, eyes, and mouth. Maintain physical distancing and avoid crowded places. If you have to be at crowded places, please put on your face mask throughout. It's your responsibility. Take responsibility and stop the spread of COVID-19. Our delectable guest has been Mrs. Opara Chizoma, the Assistant Director, Federal Ministry of Water Resources, and she also is the coordinator, Clean Nigeria.
Use the toilet.
Use the toilet campaign program. Thank you so much for being a part of this program. Really appreciate you. And as usual, we said that the program is brought to you by Widows and Orphans Empowerment Organization with the support of USAID, Effective Water Sanitation and Hygiene Services e-wash program. I have been Georgina Nduke Izanka on behalf of the production crew that worked behind the scenes. Thank you so much for watching. Tomorrow will be another edition of the program. We'll be talking to a COVID-19 survivor again. Stay safe and stay blessed.